Lovely. So it is my pleasure to reintroduce a face that might be familiar to some of you. Our presenter that we have today has presented in the past, and we liked her so much that we begged and pleaded for her to come back, which she said all right with some begrudgingness. So Tracy has been a respiratory therapist for, she says, greater than 15 years. She makes herself seem old. She graduated from the Thompson Rivers University Respiratory Therapy Program in Kamloops, BC. She's worked in acute care as a bedside clinician, a clinical educator, and providing diagnostic testing. And she is now working primarily doing education with patients with COPD. So she is a very good resource to have. So I want everybody to help me welcome Tracy. And Tracy, I'm going to hand it over to you if you'd like to share your presentation, and we will get started.
Excellent. Thank you so much. Hello, everybody. I see some familiar faces today, so that's exciting. All right. I hope you can see my presentation okay.
Looks good, Tracy.
Awesome. Thank you. All right, so welcome everybody. So today I'm going to be talking to you about COPD action plans, which is a key component in COPD management. So for today's talk, we will cover what is a COPD exacerbation, what are flare-up symptoms, we will define the classifications of an exacerbation, what triggers them and how to prevent them, what is a COPD action plan, and lastly, we will look at an example of a plan and review some case studies together as a group. So what is a COPD exacerbation? So an exacerbation of COPD is a worsening or flare-up of your COPD symptoms beyond normal day-to-day variations in breathing. So throughout this presentation, I'll be using exacerbation and flare-up interchangeably. It's not always easy to tell the difference between a bad day versus the start of a flare-up, but a flare-up usually will continue to get worse over the day, and it does not clear up with rest and extra puffs of a rescue inhaler such as salbutamol. A COPD flare-up may actually come on gradually, or it may even present suddenly. There are three main symptoms that define a flare-up. Number one, increased shortness of breath. So you may notice that you're more short of breath than normal and become more breathless than usual with routine activities. The second symptom is increased cough. So your typical cough may increase in severity or frequency, or even a new cough may develop. The third symptom is an increase or change in mucus. So you may notice a change in the color of your mucus from its normal color to yellow, green, or rust color, and perhaps the amount of mucus that you're bringing up may increase as well. It's important to recognize these three main flare-up symptoms, as they may continue to get worse without extra treatment. This can be very serious, causing you to go to the emergency room or even get admitted to the hospital. The previous slide listed the three main symptoms to watch for, but I think it's worth mentioning these additional common signs and symptoms to watch for. Increased use of a rescue inhaler, perhaps without any relief, chest tightness, wheezing, fatigue that lasts more than a day, difficulty sleeping. You may find that you need to actually sleep sitting up, low-grade fever, new or increased swelling in your ankles, morning headaches, dizziness, and restlessness, or even a need to increase your oxygen flow if you have oxygen prescribed to you. So COPD exacerbations are classified into mild, moderate, and severe based on the level of therapy that's required to treat them. So a mild flare-ups, they're treated with short-acting bronchodilators or rescue inhalers such as salbutamol, and they can be treated at home. A moderate flare-up are also treated by short-acting bronchodilators in addition to antibiotics and/or oral corticosteroids such as prednisone, and they can usually be treated at home as well. Whereas a severe flare-up usually requires a visit to the emergency room or hospitalization. So it's really important to know that moderate and severe exacerbations can lead to permanent lung damage, impaired lung function that may not ever fully recover. And it may be possible to limit the severity of an exacerbation if you get help early by starting your action plan or calling your healthcare provider before a visit to the hospital is necessary. But regardless of classification, we just must do our best to help prevent exacerbations from occurring. Even one single exacerbation can actually increase the risk of future flare-ups. It's important to recognize what are your triggers. So when you are having symptoms, take note of the things that are around you that may be causing your symptoms. And if possible, eliminate or at the very least reduce your exposure to these things. So not all people have the same triggers. So what may cause symptoms in one person may not be a problem for another person. So what triggers a flare-up? After you get a cold or flu, when you're feeling run down or tired, exposure to smoke or air pollution, after weather changes, extreme heat or cold weather, wind, or even changes in humidity level, they can help or it can cause a flare-up. Mood changes, such as feeling stressed or anxious, exposure to strong scents from perfume or cleaning supplies, or even chemical fumes, exposure to allergens such as pollen, mold, animal dander, or dust, or even using an empty inhaler, or if you have poor inhaler technique, it can cause a flare-up. So make sure you review your inhaler techniques often, especially if you're prescribed a new inhaler. So how to prevent COPD flare-ups? So quit smoking. Quitting is one of the most important steps to improving your lung health. Exercise regularly. Exercise makes your lungs stronger. By eating well and sleeping well, you will have more energy, enhancing your general well-being. Avoid sick people and wash your hands well and often. Proper hand washing can help reduce your chances of getting a cold or the flu. Get your flu vaccine every year and ask about a pneumonia vaccine. Take your medications properly and as prescribed by your doctor. And ask for help if you have questions about how or when to take medications or even what they're used for. Avoid triggers that may cause COPD to worsen, like the ones we discussed on the previous slide. And learn how to live with COPD. Educate yourself by joining programs like pulmonary rehab to help manage your lung condition. And I want to highlight and stress the importance of asking your doctor for a personalized written COPD action plan that you can follow. So what is a COPD action plan? So an action plan is a set of instructions or steps you should take at the first sign of a flare-up. It's very important to note that every person is different and needs a plan that meets his or her needs. Your action plan should be created along with your healthcare provider, kept in an accessible place in your home, and reviewed regularly. If you use your action plan properly, you will become more independent and feel more in control when your symptoms get worse. So your plan of action may make the difference between treatment at home and a trip to the hospital. So for today's talk, we're going to be reviewing the BC Ministry of Health COPD flare-up plan. So it's divided into 3 color-coded sections, much like a traffic light. Green means stable or good, continue with your regular activities and take your regular medications. Yellow means it's time to slow down and pay attention, a flare-up may be coming. And red means stop, call 911 immediately for an ambulance to take you to the emergency room. So let's start by taking a closer look at the green zone. So if we look at the top of this section, there are some blank spots to insert who the plan is for, the date that you and your healthcare provider reviewed your plan. And again, remember, it's important to review and update your plan often, especially if there's been any changes in your health or any medications that you're taking. The next space looks at your baseline symptoms when your COPD is well controlled. So it's important for you to be able to recognize what your normal symptoms are, and it will make it easier for you to differentiate what is normal and what is a change. So my breathing problems have not changed. My shortness of breath, cough, and sputum or mucus is normal for me. My appetite is normal. I am able to exercise and do my daily activities as normal. I have no trouble sleeping. Then there's a space for you to list your current respiratory medications that you're taking, including the dose and how often you take these medications. So any change in your normal symptoms may indicate that you're moving into the yellow zone. So remember, when we move from the green zone to the yellow zone, we need to start taking action. So in the yellow zone, my symptoms are worse. And remember those three main symptoms that define a flare-up. I'm more short of breath than usual. I am coughing or wheezing more than usual. I have more mucus than usual. I have green, yellow, or rust-colored mucus. So if you have one or more of these symptoms, it may be the start of a COPD flare-up. So what should you do? So in this portion of the COPD action plan, you and your healthcare provider are going to work very closely together to determine what additional treatments you will start. Some examples are your doctor may want you to increase the dose and how often you use your bronchodilator or rescue inhaler. They may want you to limit your activities and use your pursed lip breathing techniques to help manage your shortness of breath. Or they may want you to call and report these changes to them. And perhaps you even have your antibiotics and or prednisone prescriptions filled, and they want you to start taking those at home. So how do you know when to start your prednisone? So I start my prednisone if after increasing my bronchodilator or rescue inhaler, my shortness of breath does not improve and my symptoms have become worse. How do you know when to start the antibiotics? I start my antibiotics if my mucus becomes green, yellow, or rust colored, and my symptoms become worse. So when in the yellow zone, again, we're going to take action and don't wait. Remember, the longer that you wait to treat a flare-up, the longer it may take to actually recover. So what is the take home from this slide? Don't wait longer than 48 hours from the start of a flare-up to take your antibiotics and or prednisone. And if symptoms don't improve within 48 hours of taking that above additional treatment, you should contact your healthcare provider for additional support. If at any time when following your action plan, you end up in the red zone, maybe you have extreme shortness of breath or chest pain, or maybe someone notices that you have extreme drowsiness or confusion, agitation, call 911 for an ambulance to take you to the emergency room. On the back side of the COPD action plan is a space to keep track of previous flare-ups. After a COPD flare-up, it's really important to keep track of which medications you took. So for example, if you took an antibiotic, a different antibiotic may need to be prescribed for your next flare-up. Keep track of the date of your flare-ups, whether you took prednisone, what antibiotic, if any, you took, and if you had to go to the hospital. And then you can bring this information with you to your doctor's appointment. Okay, so now we're going to go over some case studies together. So this will give us the opportunity to apply the information that we just reviewed. So let's meet Charlie and take a look at his journey. So Charlie was diagnosed with COPD 5 years ago. He wears oxygen 24/7 and has been managing his COPD with the same respiratory medications for the last 3 years. Over the last 4 to 5 days, Charlie has been experiencing increased shortness of breath and cough. He even started to sleep in a recliner in the living room to rest better. And he felt like he was getting more air by sleeping upright. He'd been using his rescue inhaler multiple times a day for the last 4 days with minimal relief with his shortness of breath. Also, he noticed that his oxygen levels were lower than normal for him, and he had to increase his oxygen flow to the maximum flow that was prescribed just to maintain those oxygen levels. Last night, he was unable to sleep due to severe shortness of breath and cough. So he called 911 and he was admitted to the hospital with a severe COPD flare-up. So in this case study, Charlie was in that yellow zone, but without additional treatment, he ended up in the red zone. So what are the take-home points? So perhaps if Charlie had noticed that he had a change in his baseline symptoms and he received help early by starting his action plan or calling his healthcare provider, he may have been able to limit the severity of his flare-up and prevent that hospital admission. So again, remember, it's important to start your antibiotics and or prednisone within that 48-hour period from the start of a flare-up. Even one single exacerbation could actually increase your risk of future flare-ups, and studies show that it can actually take up to 8 weeks for you to return to your baseline lung function. Now, I want you to meet someone else. Let's meet Mary. So Mary has been managing well with her COPD. However, 2 days ago, Mary required the use of her rescue inhaler throughout the day. And yesterday, she had an increased cough with increased mucus that had changed in color from clear to yellow. Today, she has a low-grade fever. So I'd like you to think about, would these symptoms indicate that Mary is experiencing a flare-up? And remember that definition of an exacerbation is a worsening or flare-up of your COPD symptoms beyond normal day-to-day variations in breathing. So Mary's symptoms are worsening, which is a change from her baseline COPD symptoms. She is now in the yellow zone and she needs to take action. So should she start her prednisone? Yes, she has already increased her bronchodilator or rescue inhaler, and her shortness of breath has not improved, and her symptoms are worsening. Should she start her antibiotics? Yes, it's important to look at mucus color, volume, and consistency. Her mucus has increased and it has changed from clear to yellow. So yes, Mary should start her antibiotics. If she starts her action plan and calls her healthcare provider, hopefully she can manage her flare-up at home and prevent a hospitalization. Lastly, let's meet Ken. So Ken continues to work full-time. 2 years ago, Ken was hospitalized for his COPD, and after he was discharged, he was able to quit smoking. Since then, he has completed pulmonary rehab and stays active by walking daily. Over the last few days, Ken has noticed unusual fatigue and more chest tightness than normal. He doesn't usually require his rescue inhaler at all, but yesterday and today, he needed to use it for shortness of breath. So again, is Ken experiencing a flare-up? Yeah, some people may actually overlook this, but Ken is experiencing a mild exacerbation because he has changed in his baseline COPD symptoms. He's now in that yellow zone of his action plan, and he needs to take action before his COPD flare-up progresses from mild to moderate or even severe. So if we look at all of our examples on the screen, Charlie, Mary, and Ken, all three are experiencing a flare-up. They're just at different stages of an exacerbation. So while Charlie was having a severe flare-up and had to go to the emergency room, maybe Mary won't have to go to the hospital and she can manage her moderate flare-up at home if she starts her COPD action plan and contacts her healthcare provider for support. Ken may be able to stay home, referring to his action plan and treating his mild flare-up with a bronchodilator or rescue inhaler, and by resting and using his pursed-lip breathing techniques to manage his symptoms. It's so important to know your baseline COPD symptoms, so when your symptoms change or worsen, you can refer to your action plan that you have been given by your healthcare provider. So in summary, take your regular daily medications as prescribed. Don't wait more than 48 hours after the start of a COPD flare-up to take your antibiotics and or prednisone. If symptoms don't improve within that 48-hour period of starting to take that additional treatments, you should contact your healthcare provider for additional support. So I hope if you don't have a plan and you have COPD, after today's talk, I really encourage you to make that appointment with your healthcare provider to get going and start setting one up together. Prevention, early detection, and prompt treatment of exacerbations are vital to reduce the burden of COPD. And that concludes today's presentation. Thank you so much. I'm going to stop sharing so I can see everyone again.
Thanks, Tracy. I love your talks. They're so good. I didn't, let's just jump straight into the chat box. Let's address those first. And then what we'll do is we can let you unmute yourself, say your name, and then ask the questions to Tracy. The first question, Tracy, that was sent in advance, and Maureen just sent it to us, was a patient was asking about the use of oil of oregano. They've been using it for the past 3 weeks. They have stage 2 COPD. They've noted that they've had an improvement in their symptoms, and it's now become part of their action plan. Have you encountered this?
I have not. Have you, ladies? I actually haven't.
No, and while you were speaking, what I did is a bit of digging around, and Alexa did as well. And what I have found is that it's very early in the research, but what they're finding is that it does have antioxidant properties. However,
And anti-inflammatory.
an anti-inflammatory, but it should only be taken orally. It shouldn't be inhaled because then it can irritate the airways quite a bit. That is all we've really seen.
I've had this question asked to me a few times on the Better Breathers Facebook page.
Okay.
And like looking into up to date and the credible research areas, everything, like there are studies out there, but really the thing that always comes back is that, yeah, it's early in its research stage. And yes, it has compounds of anti-inflammatory and antioxidants. More human studies would need to be done. And I just don't know, like everything I read, it just doesn't sound like it's as impactful as, taking, your puffers, because your puffers are designed to be taken to the area where you want it to work. Anytime you take something that's, systemic, you have to think, just because it's a oil of oregano and it's natural, everything has reactions within the body too. So because it's systemic, it's going to work on all different parts within the body, whether that be good or bad. I know when I did look at a few of the studies is what is the amount that you would need to have these anti-inflammatory and antioxidant properties. And for some people, it would actually make them quite nauseous because you would have to take quite a bit of the oil in to get those properties. So, that's why these puffers are designed to be inhaled to go to the source of where you want to reduce the inflammation. So any of you that are on any inhaled corticosteroid, that's an anti-inflammatory. It's to reduce inflammation in your lungs. So I would suggest that there's a lot more studies on that, that it would work. And the biggest thing that we know about inflammation is that we don't want inflammation to take over within our lungs because that's going to lead to scar tissue. So I would choose something that's probably a little bit more science-based, knowing that, hey, I'm conquering this inflammation within my lungs. I'm preventing scar tissue from breaking down. I'm preventing these flare-ups from occurring, where I'm not sure if taking this natural source of oil of oregano is going to be doing the same benefit. It's kind of what I get from looking at these research articles.
If the person whose question this is logged on, if you want to unmute yourself and let us know how it's going, it may have effects that we just are not aware of. Like Alexa said, the research is early, but you have to make sure that you're safe using it, I guess. But does it sound like anybody's question?
I don't think she's on here. The initials were BF, so no.
Oh, okay.
The other thing, I think, like, it might be something that you can use in conjunction. So like there's oil of oregano type teas and stuff like that. Anytime you're using or taking any form of supplement, whether it be natural or not, it's always still good to let your pharmacist know that, because using or taking something that is what's the word I'm trying to think, more natural, it's just because it's natural doesn't mean it may not have a drug interaction with something else that you're taking. So If you are considering adding this to your line of therapy, just make sure that you have that conversation with your pharmacist so they can look at what you're taking and make sure there's no drug interaction and you're not getting a side effect that you may not be aware. Hey, this is because I'm taking oil of oregano. You might blame it on something else. So just a good reminder.
That makes sense. Thanks, Lex.
Yeah.
Anyone else have any questions for our speaker regarding your own action plans or the generation of your own action plans?
Hello, I
Or-
have a question.
Yes, what's your name, my
Yeah,
friend?
my name's Kathy.
Lovely to meet you. What's your
You as
question?
well. So as we're discussing, oftentimes you would say taking antibiotic and or prednisone. And I'm often faced with a situation where my breathing's bad. I really want to take that prednisone, but the sputum is clear. There may be more, but it's still clear. Should I then take the antibiotic as well?
Tracy, I'll let you answer that one.
Yeah, so you're saying you have symptoms of shortness of breath, struggling with your breathing, thinking
Yep.
you're having a flare up,
There's
but
been
you're
change in
thinking,
yeah, no question. Change in my breathing. Yeah.
yeah, but you're not thinking it's an infection because your sputum hasn't changed color.
Well, I mean, I'm not sure. It just the sputum hasn't changed color, but there may be an infection. I don't know. And I want to get a handle on it quickly. And so I'm
Yeah.
tempted to take both just for the hell of it.
Yeah. I mean, I would definitely advise you to connect with your doctor if you're lucky enough to have a doctor or even a lung specialist, right? Just for some direct advice from them. But definitely, as if you're following the action plan, that shortness of breath that you're feeling is the prednisone that's going to help manage that. And then to fight that infection, that bacterial infection, if your sputum has changed or if you have lots of mucus, that's where that antibiotic comes in. And the reason we don't want to always be reaching for that antibiotic is because of that resistance, right?
Yeah.
So we want to be conscious of how often we're taking the antibiotics.
Yes.
Yeah, but again, I would, because there is some clients that definitely will have to take both right away every time they have a flare up. But I would absolutely advise you to connect with your physician for some guidance in regards to that.
Perfect. Thanks very much.
Thanks, Kathy. Anyone else have a question for Tracy?
Hello, can you hear me?
Yes, who is this?
My name's Bob.
Hi, Bob.
Hi there. I was the one who sent in the question on the oil of oregano,
Oh, okay.
and my feedback is that it's helped me.
Good.
And you know, I take a bronchodilator, salbutamol, and I'm on Trelegy. And in the past year, I've had 3 flare-ups or exacerbations. And my doctor has provided a standing prescription at the pharmacy. So when I've had these significant events, you know, I just call up the pharmacy and I don't have to wait, et cetera, et cetera. But again, back to the oil of oregano, it's helped me. You know, I'm not doing it in isolation. The only thing, and your comments important, which is the next time I speak with my respirologist, I will tell him that I'm doing this, just so he's informed, you know?
Yeah.
So the takeaway for me to the audience today is try to get a standing prescription at the pharmacy so that it's there if you need it, you know?
Yeah.
Rather than having to call the doctor, et cetera, you might not be able to get in contact with him or her, and then it becomes a bigger issue.
Thanks for sharing that, Bob. I would have to agree with you absolutely, because you know those flare-ups are always going to happen on a Friday night, right? When you can't
Right.
contact your physician. So I love that you have that standing prescription with your pharmacy, so you're able to go fill it if you're struggling and you know you're having a flare-up. Or even some folks will actually fill those prescriptions and bring that medication home, especially if you tend to have flare-ups quite frequently. And you have that medication in your home ready to go when you're struggling, when you're starting to have that flare up. Yeah.
Yeah. And it's interesting that the doctor called it my action plan. Just, you know, Okay, thank you.
Yeah, and I mean, ideally, the thought process behind a plan is ultimately to give you that control, to give you that confidence that you're able to manage your lung condition, and hopefully keep you out of the hospital, right? If you have access to the steps and the medications that you need to treat your flare up, hopefully you won't end up in the hospital, right? So that's where that action plan is coming into place. And just to further on that topic where we were talking about having, if you were to fill your prescription, I chatted with the pharmacist, and if you're able to let them know, I'm filling this prescription for my action plan, but I'm not planning on taking it right away. Maybe they can give you a longer expiry date on that medication just to make sure your medication isn't going to expire within 2 months of you filling it, or even just adding that expiry date on that medication, because sometimes it comes without that expiry date, can be helpful for some. Yeah.
Yeah, good point. Thank you.
Mhm.
Thanks, Bob. Thanks, Tracy.
Mhm.
We have another question that was sent in through the chat box. It comes from Jim, just asking what the difference between Robitussin and Benylin is. Should you avoid their use? Surely I should not suppress the coughing mechanism. So I can take this one, Tracy, if you want me to.
Mhm.
So Jim, if you want to come on or unmute yourself if you want to chit chat, but both medications are cough suppressants. They have a drug, and I always fumble over how to say it, but it's dextromethorphan. And so it's a cough suppressant, but it's not a medication that eliminates your cough. Coughs are effective and you need them for bronchial hygiene. You need to be able to cough effectively to clear any goop out, especially if there's an increased mucus production, or you have sputum, or there's an infection. It's better out than in, is what I tell my students all the time, right? Better to cough. What the purpose of this is to, if you find that you are coughing so much that you cannot effectively lay down or rest in order for your body to heal, you might need a cough suppressant just to limit the amount of irritation that is occurring. And generally it's the upper airway, so the back of your throat, that kind of gets raw, irritated from chronic frequent coughing. So this can help suppress that cough a little bit, but it does not eliminate your ability to cough effectively when you need to. It's just to relieve some of the symptoms, if that helps answer your question. If it doesn't, please unmute yourself and ask away.
Thanks, Lindsay. The reason I asked was that it seems to go against my logic. A person who was suffering from an exacerbation, who was coughing like crazy, would then take something to stop the coughing, thereby, what will I say, turning against the whole notion of getting rid of what's troubling you anyway.
Right. Yeah. You're thinking, oh, my body's telling me I should be coughing, and I'm giving a medication that's saying don't cough. It's just to suppress the irritation of a chronic cough. If you find, have you ever had a cough where you just cannot stop coughing? You lay down, it's cough syrup essentially. So you can still effectively cough if you need to. It's just to provide some relief of that kind of irritation.
Okay, thank you. I
Okay.
thought you were kind of a band.
No, you're fine. But make sure that you are taking the recommended dosages, because you can overdo it. So follow the instructions that are on the back of the bottle. Okay.
Thank you. Thank you.
You're very welcome. That was a good question. Anyone else have any questions for us? I think everybody's a pro at action plans. No other questions from the group? Well, alrighty then, my friends. I think then, if no one has any other questions, also remember that you can post any questions that might come up on the Better Breathers page. Oh, Tracy might have a question.
No, I don't have a question. I just wanted to share with the group, because there's a lot of folks signed on today. I just wanted to share a free program that's actually being available in BC for BC residents through the BC Lung Foundation. And so it was designed for folks that have been diagnosed with a lung condition within BC. And it's a program that was actually developed by the COPD Foundation in the United States. And it's funded by the BC Lung Foundation. And it's actually hosted by Poplar Pulmonary Wellness. And this program is called Harmonicas for Health and Happiness. Has anybody heard of this program before? I know. Hi, Ted. Yeah, so it's a wonderful program that teaches folks how to play the harmonica, which is actually exercise for your respiratory muscles, believe it or not. And when we were talking about secretion clearance, that's another one of the benefits of playing harmonica, is it can actually help you clear secretions, strengthen your muscles. It actually mimics pursed-lip breathing, that breathing technique that all the RTs are going to be teaching you to help manage your symptoms. And so just by playing the harmonica, you'll be exercising those muscles. So if anybody's interested, we have 3 more sessions happening. The next one's happening quite quickly. I believe November 18th is the first day, but there'll be 2 more sessions after that. So it's a 5-week program where you'll meet once per week for an hour, and you'll receive a harmonica and a player's manual, and you'll sign in virtually, just like you did today, and learn how to play the harmonica.
I
So
have to
if you're
say, for like feedback too on that program, there's been such fantastic feedback. I've had some people that are on the Better Breathers Facebook page that have said that they've gone through the program, and just learning, it just really helps them with their breathlessness, and there's just been fantastic feedback on it. And you guys have been doing this talk for a bit, and there's been quite a bit of interest now across Canada for this program. So
yeah,
sign up.
yeah. Yeah, no, for sure. So it's a group program. There'll be 2 respiratory therapists that'll sign on and guide you through the sessions. And it'll be a group. So depending on how many folks sign up, I can put it's through Popular Wellness. I actually do have the link. So once I get a second here, I'll put it in the chat for you guys. If you're interested in signing up, you just need to connect with the Popular Wellness community and sign up for a session to get assessed, and hopefully they'll be able to send you out your musical instrument and the player's manual. Yeah.
Tracy, thank you for that. Yeah, I have yet to be able to attend a talk about it, but I am jealous that people are able to attend it. I think it's phenomenal. One of my students actually took up learning how to play the harmonica on her own as a stress reliever. And she also gets to make some nice music.
Yeah. And I have no musical background, and I now can play the harmonica some. So there's no pressure if you're not musically inclined. That's okay. We welcome you with open arms.
Perfect. Thank you for mentioning that. And I encourage everybody to click on the link and take a look at the webpage and see if you can meet it, because it actually has proven to be beneficial, quite beneficial. So anything and everything that we can do.
And the ladies that run it are fabulous.
Yeah, they're not too shabby.
Yeah, it's pretty fun.
Yeah.
It is a fun program. I'm in it.
You're just showing off, Ted.
No, no. It's enjoyable.
Yeah.
Wonderful.
I love
Good.
hearing
Firsthand.
that.
Well, then I'm going to say thank you so much to everyone for attending. Thank you, Tracy, for your time today. This was a wonderful talk. Reminder to everyone, it will be posted on the YouTube page in the next few days. And then December 13th, 11th.
It's December 11th, Wednesday, December 11th. We will
Right.
have Sherry with us talking about stress and anxiety and mindfulness. So I did have the pleasure of listening to this talk at the BCSRT conference that we had. So it's a conference for respiratory therapists, and it's very well done. So if you have a chance to be able to come in and ask your questions, it'll be a really great talk to attend.
Wonderful. All
Thanks,
right, everybody.
guys.
We'll see you in a
Have a
few
wonderful
weeks.
day.
Have a lovely day.
Thank you.